Wondering what you need to know before getting a Moderna COVID-19 booster shot? Want to know what side effects you should watch out for and why it's important to get the booster? Keep watching. Moderna's COVID-19 booster shot contains half the dose of the shot used in the primary series. Although the dose is smaller, the side effects seem to be similar to those seen after the second Moderna dose. Based on data taken by Moderna, the most common side effects of the booster shot include injection site pain, fatigue, headache, muscle pain, and joint pain. Chills, nausea, and vomiting have also been reported. Symptoms seem to be worse in recipients ages 18 to 64 and not as severe for those over the age of 65. However, data from Israel's booster shot program indicates that symptoms are less severe overall after getting the booster shot than they were during the initial shots. Fewer side effects have been reported for both the Pfizer and Johnson & Johnson vaccines, and experts expect the same data to follow with the Moderna booster shot. Moderna's COVID-19 booster shot side effects may be less severe because the dose is smaller, but it may also be because people are more prepared for the experience. According to Robert Weber, administrator for pharmacy services at The Ohio State University Wexner Medical Center, people who are getting the booster shot know what to expect and how to prepare this time around. He told the AARP, "I think people also understand how to manage the side effects better in terms of drinking plenty of water prior to getting a vaccine, drinking plenty of water after you get the vaccine, taking it easy the next day." Being less nervous about receiving the COVID-19 booster may also prevent symptoms like anxiety, which can make other symptoms feel worse or more concerning. AARP also noted that health officials have said it is okay to get a booster shot from a different brand. If your symptoms were particularly uncomfortable from Moderna's first 2 doses, for example, you may be able to get a Pfizer booster shot instead. Although experiencing side effects from a vaccine can be nerve-wracking, mild to moderate symptoms are very common. According to the CDC, your body creates an immune response to the vaccine that will protect you in the future. If the disease you are being vaccinated against ever enters your body, your immune system will be prepared to fight it. Mild side effects including injection site pain, fatigue, headache, muscle pain, and joint pain are all extremely common. You shouldn't worry if you experience those effects after receiving Moderna's COVID-19 booster shot. Some people are concerned about long-term side effects, but experts say these are rare. According to Women's Health, most side effects occur within a few days or weeks of receiving a vaccine or booster. Dr. William Schaffner, an infectious disease specialist and professor at the Vanderbilt University School of Medicine, said, "Thinking of all the vaccines we use in childhood and adulthood, I can't think of any long-term side effects. Vaccines don't have a bad effect that occurs 8 months, a year or 2, or longer." All vaccines and boosters, including the ones developed for COVID-19, go through a rigorous testing process through the FDA before they are authorized for public use.
2 things that people should know is that the booster is still safe, and if you got the full dose without the booster, you still have incredible protection against hospitalization and/or death.
Of course, regardless of how effective a vaccine is, its efficacy can wear off over time. This has been the case with the COVID-19 vaccines as well as many other vaccines in our history. The prevalence of new COVID-19 variants also affects the initial vaccine's efficacy. The antibodies we create after our first doses may not be as effective at fighting these variants, and a booster shot can make sure we are better protected. So far, the Pfizer and Moderna vaccines have been highly effective against the various COVID-19 variants that have emerged. If you are eligible for a booster shot, getting one can significantly reduce your risk of developing COVID-19. The Centers for Disease Control and Prevention released a study on October 29th that shows that vaccination against COVID-19 offers better protection against the virus than a previous infection. If you have already been vaccinated, a COVID-19 booster shot can increase your level of protection. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest health topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.